Dear colleague, today we will discuss bilateral clubfoot through the observation of two different clinical cases. The first concerns a pregnant woman who came to our attention at 14 weeks and 3 days with an ultrasound finding of bilateral clubfoot. The second case, on the other hand, involves a pregnant woman who came to our attention at 23 weeks of gestation. During the ultrasound examination of the latter, not only was bilateral clubfoot detected, but also joint stiffness. Congenital clubfoot is defined as a heterogeneous group of deformities in the position of the foot relative to the axis of the leg. In 40% of cases, it is unilateral, while in 60% to 70% of cases, it is bilateral. Some authors have also made a distinction between the simple form and the complex form, depending on whether or not there is an association with additional fetal anomaly, depending on the degree and direction of the foot's torsion. We distinguish the equinovarus supinated foot, which represents the vast majority of cases of congenital clubfoot, characterized by plantar flexion, adduction, and inward rotation of the foot, the talovarus foot, and the metatarsus varus clubfoot, which accounts for 5% of cases. The incidence of congenital clubfoot is 1 in every 1,000 births, with a male to female ratio of 2 to 1. The pathogenesis appears to be associated with a family history. In fact, heredity has been demonstrated in 15% of cases, even with generational skipping there, but clubfoot can also be linked to chromosomal disorders. In particular, a correlation of up to 4% has been observed with trisomy 18, but also with syndromes that have dominant, recessive, or X-linked transmission, as well as with the presence of additional vertebral anomalies such as spina bifida or sacral agenesis. This is why in the images below we see particular attention being paid to the study of the posterior cranial fossa. In spina bifida, in fact, the banana sign of the cerebellum will be present, as well as obliteration of the cisterna magna. In this case, however, we do not see any anomalies of either the cerebellum or the cisterna magna. These are characteristic ultrasound signs of spina bifida because the vertebral schisis is not always visible. In addition to a careful examination of the posterior cranial fossa, it is therefore fundamentally important to focus on the study of the spine, particularly paying attention to the sacral region, also because of the correlation, as we mentioned, between clubfoot, whether unilateral or bilateral, and sacral agenesis or caudal regression syndrome. In the case at hand in particular, we see that the terminal portion of the sacral spine appears normal and is still in a cartilaginous state, as is physiologically expected at this stage. Once we have paid particular attention to these structures, it becomes fundamentally important to study the fetal anatomy as a whole, also focusing on the evaluation of the cardiac anatomy, which in this case appears normal and allows us to breathe a sigh of relief. Also from this point of view, particular importance has been given has been placed on the visualization of the four chambers, the left section, the right section, as well as the aorta, the pulmonary artery, and above all on the most important cardiac section, which appears to be the three-vessel trachea view. This last one also appears to be normal. At this point, attention is focused on the visualization of the anatomy of the limbs, the lower limbs in particular, starting from the femurs, appear normal in terms of the biometry. In fact, it was even observed that the fetus as a whole appears to be 6 days larger. The ossification of the femur is normal on both sides, and the ossification as well as the biometry of the tibia and fibula also appear normal. Here they are in the images. We see the characteristic ultrasound sign of congenital clubfoot is clearly evident. In particular, when observing the bones of the leg, physiologically the foot should not be visible. However, in the images below that we can see, the foot appears to be visible, and in particular, the toes are splayed out like a fan. It is important to emphasize that the ultrasound diagnosis of congenital clubfoot, especially at this stage of gestation, is not as straightforward as it may seem. In fact, particularly in the absence of other associated congenital anomalies, the diagnosis must be made with extreme caution. It should also be noted that certain forms of clubfoot, such as the metatarsus varus variant, which actually accounts for only 5% of cases, but is still a possibility we might encounter, cannot even be detected prenatally. Therefore, a definitive diagnosis must be made at birth. A second fundamental assessment appears to be that of joint movements. The fetus in question has performed regular flexion extension movements. It is also of fundamental importance to visualize the upper limbs, which in this case appear normal in terms of morphology, ossification, and biometry. The hands also appear normal on both sides, with neither side showing the characteristic clenched fist appearance that, as we will see in the following case, is instead, as you can clearly see, much more typical of the suspicion or the diagnosis of arthrogryposis. In fact, in the images that will follow of the fetus in question, we will see how it will show us all 4 fingers of the hands open. And the presence of open fingers will allow us to rule out arthrogryposis. Here in the following images, we can clearly see all 4 fingers of the hand open. So what should be done in cases of bilateral congenital clubfoot? In this case, the fetus did not present any further anomalies, so it will probably be a simple form. Nevertheless, caution always requires that the expectant mother undergo genetic counseling as well as a fetal karyotype examination with particular attention to the study of diseases related to joint stiffness. The expectant mother should inform the geneticist about the importance of investigating this type of anomaly and, of course, arrange for a pediatric orthopedic consultation at birth. Congenital clubfoot can also be associated with conditions such as arthrogryposis. Arthrogryposis is a characteristic sign of about 120 different syndromes and is distinguished by the presence of multiple joint contractures visible on ultrasound examination. It can be caused by various conditions, such as chromosomal aberrations, aneuploidies, neurological abnormalities, and sporadic forms. In particular, trisomy 18 is the aneuploidy most frequently associated with arthrogryposis. Other causes may be linked to syndromes inherited in an autosomal dominant recessive or X-linked manner, as well as a portion that is sporadic and appears to be associated with infection or malignant hyperthermia. Arthrogryposis can be divided into 3 groups, which include O forms involving a single limb, those with generalized neuromuscular involvement, and those with concurrent neuromuscular involvement of the central nervous system. However, only in half of the cases is it possible to make a precise diagnosis of the type of disorder. The incidence of arthrogrypotic syndromes or joint stiffness is 1 to 3 per 10,000 births, with an equal ratio between the 2 sexes. It is of fundamental importance in cases of clubfoot and suspected joint stiffness syndrome to conduct a thorough study of the fetal anatomy, and that in every aspect paying particular attention to the study of the cranial fossa, as well as also paying special attention to the study of the spine. In this case, in the case under examination, the spine appears normal, and the sonographer paid particular attention to the distal section of the spine and the sacrum, which in this instance is clearly visible. We can see how the latter, the sacrum, extends beyond the ilium in the images below, which is a key sign for ruling out caudal regression syndrome or sacral agenesis. It is fundamental and of utmost importance in these cases to pay particular attention, of course, to the examination of the lower limbs, and in particular to the study of the flexion extension movements of the lower limbs. In fact, from an ultrasound perspective, this pathology is characterized by an abnormal position of the limbs with the presence of multiple obvious joint contractures. In particular, throughout the entire examination, the mesometic structures of the lower limbs of the fetus in question remained extended, and no flexion extension movements were observed. The foot, as we can see in the images below, appears twisted. In fact, as we mentioned earlier, during the ultrasound examination of the leg, we are able to visualize the foot, something that physiologically is not visible in a healthy fetus, and the toes are splayed out like a fan. Furthermore, now, as we can see, the fetus never assumes its normal fetal position, which is characterized by the legs being bent at the thighs bent toward the pelvis, and the feet crossed underneath the buttocks. In this particular case, however, throughout the entire duration of the exam, which lasted for more than 50 minutes, the fetus maintained this position. It is of fundamental importance in cases like the one in question to also carry out a careful evaluation of the upper limbs. In fact, in cases of dysmorphic syndromes or joint rigidity, the upper limbs are constantly flexed. The hands usually do not always appear clenched into fists, to the point that, in fact, it has even been observed that in the most severe cases, the fetus appears to be completely immobile. In the images that will follow, we will see how the fetus will show the presence of the lower limbs and of the upper limbs, which appear to display a slight joint rigidity, even though following stimulation by the sonographer, but only and exclusively following stimulation, not by the sonographer. The fetus sometimes, though rarely, shows the fingers of the hand. Generally, in the case of fetuses with arthrogryposis, polyhydramnios also appears around the 26th week of gestation. In this case, however, the amniotic fluid is normal, and anomalies of the central nervous system can be present in 10% of cases. In this case, however, they are not present. Therefore, it is of fundamental importance in cases of suspected arthrogryposis not only to carefully assess the entire fetal anatomy, but also to conduct a sufficiently long ultrasound study that allows us to determine whether, even over an extended period of time, the fetus maintains this position and that it is not simply an abnormal posture. What to do in these cases? Well, in such cases, it is of fundamental importance to request a genetic consultation and to inform the expectant mother about the need to carry out a thorough study of the fetal phenotype, with particular attention to the assessment of arthrogryposis, but above all to the evaluation of the most serious condition, type 1 proximal spinal muscular atrophy. Thank you for your attention.